So the goal of this study was to characterize a phenomenon known as biologics dose elevation. Biologics dose elevation is an inherent feature of biologic treatments, where over time they can have a decreasing response rate due to immunogenicity. But it hasn't really been characterized in terms of how prevalent this is and to what level it actually occurs. So the goals of this study were to actually determine how prevalent it was, when did it occur, and to what level it occurred. And we wanted to look at actually what happens in a psoriasis population, specifically looking at the treatments that are related to psoriasis in a Canadian population. Now, the way we went about this was to use an administrative claims database, the IMS Broken claims database. It lacks diagnosis code, so we had to infer a psoriasis diagnosis based on the treatments that a patient were choosing to take. And we selectively chose treatments that are very specific to psoriasis to kind of ensure that these patients actually were psoriatic patients. So we selected patients who had those treatments, and then we looked to see when they had their first biologic treatment. And those biologics could have been adalimumab, etanercept, infliximab, or ustekinumab, common treatments that are approved for psoriasis, and at the time when we were studying this particular phenomenon. So we looked for the first instance of their biologic treatment, and then we followed the patients for 1 year. They had to stay on the treatment for 1 year, so we could really compare apples to apples in terms of if they were experiencing dose elevation and to what degree they were actually experiencing dose elevation. What we found was patients that were taking etanercept actually had the most prevalent amount of dose elevation. And dose elevation was defined as having 20% or more amount of product available to them for a time period above the Canadian recommended product monograph. And they had to have 2 instances of these at any one point in time to kind of be labeled as someone who is dose elevating. So, as I mentioned, etanercept had kind of the highest prevalence of patients, and that was statistically significant compared to all the biologics, although all biologics did display some level of dose elevation. We also looked at the amount of dose elevation in terms of the average amount over the time that they were dose elevating, and we actually didn't find any statistically significant differences amongst all of the 4 biologics that we examined. And then in terms of time, our last aim, when did the first instance of dose elevation occur? We actually found etanercept again to have the shortest time to dose elevation, and that was statistically significantly different than adalimumab, but not statistically significant compared to infliximab or ustekinumab. So in short, what this suggests is that dose elevation is prevalent amongst all biologics, but interestingly seems to have a higher prevalence in etanercept, patients taking etanercept, and also occur quicker in patients taking etanercept, although the amount of dose elevation doesn't seem to vary across any biologic.
Thank you for your time. I appreciate it.
Thank you.